Welcome, everyone, to the January virtual road trip. Happy New Year. And we see people getting on quickly, so we're going to give a few moments as people get comfortable. And I see the participant list growing quickly, so we'll just wait a few minutes for introductions for Susan and I. I'm Pam Brandon, and I'll tell you a little bit more about us in a moment, but welcome on Inauguration Day. Got a lot going on today. So Susan, remind me where you're located.
I'm in Maryland,
Maryland.
so I am west of Baltimore is where my home office is.
Okay. And I knew that, and then all of a sudden had a moment of forgetting it. So for our virtual road trip, folks out there, we are traveling to Maryland today. So East Coast, you don't have any snow going on?
We have no snow. We actually had a few flurries this morning. It's a bit windy, 30s, mid 30s. So
okay.
Yeah, it's not too bad.
Yeah, and we're just a little bit warmer here in Texas. So welcome to smack dab in the winter, right?
Exactly.
Well, we'll go ahead and get started as people are coming on, because we have a lot to talk about, and delighted to be welcoming Susan to our road trip this month and to kick off the new year. So really honored to have her, and I'm going to tell you about Susan in just a minute. For those of you who have been following us on the virtual road trip, welcome again. And I know we have some new folks, so I just want to share a little bit about who AGE-u-cate is. We develop and deliver aging and dementia care training for professional and family caregivers. Our research-based training includes Dementia Live, Compassionate Touch, Flashback, and our newest programs, Reading to Connect and Ageless Grace, which we added to our family of programs. So we work with providers from across the spectrum, aging services providers from memory care, nursing homes, assisted living, home care. We work with universities and community-based organizations. So we work with over 800 providers who have implemented our programs in the States, as well as Canada and Australia. So that's a little bit about us. We're excited about going into this year with our focus on workforce retention and reskilling programs, and we'll be announcing what we'll be doing in that arena under our Reveal Aging initiative very soon. So a little bit about us, and of course, if you're interested, you can contact us and find out more. But I'm really here to welcome Susan Ryan from the Greenhouse Project. Susan has been with the Greenhouse Project for 12 years. She is the senior director and has led the organization through key transitions over the past 12 years. And certainly we all know about key transitions, and as we've all had to experience in the last 12 months or 10 months, 11 months, I guess now. She is an international speaker, and I know she is missing her speaking engagements. But you will be out there again, Susan, for us to listen.
Sure, I will.
Yeah. Thought leader, passionate about the accessibility of quality long-term care environments that are affordable and accessible to all. And I cannot say how much I share in your passion in that arena. I have so much respect for the work that you do, Susan, and for the work that Greenhouse Project has done to make a difference in this space. So I'm honored to have you here. So welcome, Susan.
Well, thank you, Pam. And I'm grateful that you asked and reached out. I think LinkedIn has become my new favorite community, where I've gotten to know so many people really just through those LinkedIn connections, since we aren't going to conferences to have that firsthand account. But it was helpful. I'm glad you reached out, and glad to learn more about AGE-u-cate and all the work that you all do as well. And I would say what binds us together is our quest to really make a difference, especially for those living with dementia. And how do we support care teams to do more of what needs to be done to ensure those quality of life experiences happen? So I thought what I would do today is to make sure we all start on the same page. You know, you heard a little bit about me, but let's really talk about the organization that I represent, and that is the Greenhouse Project. And it really is the greenhouse model that amid the pandemic has really garnered some significant media attention, of which I am humble and grateful and just so proud to be associated with them. So I thought what I'd do, Pam, first is we're going to do a virtual tour. And to your point, this is your virtual road trip. We're in Maryland, kind of in my home office, but we're going to go to Rhode Island. And we're going to go take a look at one of 4 greenhouse homes in the state of Rhode Island. And so I'm going to try to share my screen. And if it gets ugly for a minute while I'm sharing my screen with all the stuff that's on my page, forgive me, but let me go back for just a moment, make sure that we are. All right. And I think we're good.
We are good.
Welcome to the Greenhouse Homes at St. Elizabeth Home, a new and innovative model of nursing home care. These 4 greenhouse homes are each nursing homes for 12 individuals. St. Elizabeth Community is proud to open the first greenhouse homes in Rhode Island. Located on a cul-de-sac adjacent to St. Elizabeth Home, this intimate residential setting is unlike any nursing home in our state. Offering both privacy and autonomy for the residents, the model of care is a proven model which employs cross-trained certified nursing assistants and nurses. Let's take a look at one of the 4 greenhouse homes at St. Elizabeth Home. Upon entering the home, you come into the hearth room, a warm and inviting space for gathering, with a gas fireplace and a large wall-mounted TV. A sunny sitting area is off the hearth room. The den, adjacent to the hearth room, is an ideal place for reading, playing games, or visiting. Doors can be closed for privacy and quiet. The entire home has radiant floor heating, which provides exceptional warmth and comfort. The heart of the home is the spacious kitchen and dining room. An open floor plan encourages community and fosters interaction. The kitchen is inviting and designed so residents can easily help in preparing meals or simply enjoy being in the kitchen. The dining room table is large enough so that all residents and staff can share meals together. And families are welcome to enjoy a meal with their loved one individually or with the community. Each private bedroom has been thoughtfully designed. A built-in locked medicine cabinet is located at the entrance. Rooms are fully furnished and have cable and Wi-Fi free of charge. Individual heating and air conditioning controls give residents the ability to adjust temperature for their personal comfort. A built-in ceiling track would allow for a resident to be lifted from bed to bathroom if needed. All rooms have private, accessible bathrooms with walk-in showers. A call system is in place in bedrooms and bathrooms so residents can alert caregivers. A master bathroom has a whirlpool soaking tub and adjustable hairdresser sink. The spacious room has a large mirror and heat lamps in the ceiling for extra warmth. A courtyard and screened porch complement the beautiful interior space. Residents are invited to participate in daily activities they enjoy. Laundry is done by the staff, but if a resident or family member prefer doing their laundry, they are welcome to do so. The greenhouse home concept of living empowers staff to support residents to live life to the fullest in a real home with privacy and community. Thank you for taking the tour of the greenhouse homes at St. Elizabeth Home. For more information, please call 401-471-6060.
I love going into those homes, and when people usually see those homes, they have a couple comments. First of all, they say, well, that must be assisted living, or you certainly couldn't care for people that have high care needs. No, these are really licensed as skilled nursing. And as somebody's care needs were to increase, then they're able to stay and receive care in that home. The other thing that I think is important to say is that most people look at it and say, well, what does it cost to live there? This must just be for people who have the wherewithal to pay privately. In the particular 4 homes that you saw, 40% of those living in the homes are supported by Medicaid. And I actually just got that number today. I was talking to the CEO from there. So it's not just a private pay funded model of care. It's designed to work within the current regulatory and reimbursement structures. I did a finance survey in 2017, and at that time it was about 47% of people living in greenhouse homes. So almost half of those folks were supported by Medicaid. So obviously, we know COVID hit nursing homes particularly hard. And that when you look at cases and deaths, even over 400,000 deaths right now, and 40% of those have been in nursing homes among elders and staff. So I think as we look to the future and we kind of figure out, so what do nursing homes do? Is it all about diverting everybody into home care, or is there something from which we can learn that would give us opportunities to rethink, reimagine, and build upon what we've learned? So I'm going to share my screen once again and show a few slides just to tell us a little bit about the greenhouse experience during COVID-19. And I will tell you, my background is nursing. So to me, the thing that is most important it's not most important, but it's really important to me. Everybody looks for the evidence base. Everybody looks at data. And I will tell you, it was probably April of 2020. I had a researcher from the University of North Carolina, Dr. Cheryl Zimmerman, who reached out to me. She had done research on the greenhouse homes. I met her actually the first year that I was at Greenhouse, and she was doing kind of a literature review on what would make the evidence base for elements of greenhouse. And so in the subsequent years, I got to know Cheryl well, but she reached out in April and she said, first of all, want to make sure you're okay, but how are the greenhouse homes doing? And there's something in my gut that says these homes should be doing pretty well. And could I be your COVID research advisor and just really help with creating a methodology to capture data? So with Dr. Zimmerman's assistance, we went to work. Well, CMS wasn't reporting data, as you might remember, until about May of 2020. So our first data submission went out to capture data from February through the end of May. We worked with Dr. Zimmerman actually through the end of July. We continued to collect our data, and I'm going to share that in just a moment. Literally, Pam, as you and I logged in at 1:30 or 12:30 Central Time, I got a notice from Cheryl, an email from Cheryl saying that the manuscript that she has prepared with research was just accepted by JAMDA. So I will be excited to share those results that drill down more deeply. But I'm going to give you a high level. And here's what I want to show you. We took a look at confirmed cases per 1,000 nursing home residents by month. The green is greenhouse, the blue is CMS reported data. So all CMS nursing homes had to report their data. Once again, they did that first big swath through the end of May. And you will see per 1,000 kind of where CMS confirmed cases were through, it says January through May. I don't think there were likely cases in January, but that's how CMS captured their data. And then you can see June, July, August, you can kind of see the upticks where things were going. You might remember everybody talked about the twindemic or what might happen with holidays, where you can see cases took a surge in both CMS data as well as greenhouse data. But take a look at the next slide. Take a look at mortality. And I want you to particularly notice the difference between greenhouse and the CMS reported data in terms of mortality. That's significant to me, that there is no home that is impenetrable to the virus. But what has greenhouse been able to do, even if there was a confirmed case, a positive diagnosis, to be able to keep people living and living well, shall we say. So here's kind of the cumulative data. So if I were to say, how did greenhouse do compared to CMS throughout the whole year? So, I could show you month by month, or I could show you this slide. And you'll see on the left, once again, greenhouse did, more than 50% better than in terms of number of cases when you look at the year. And then when you look at deaths, far better in terms of really ensuring that people lived and they were able to, actually just go beyond a COVID diagnosis, but to go back. But I think, Pam, what you and I want to know is, what about socially? We heard so much about social isolation, and how did it happen in greenhouse homes? So let me just tell you a few quick stories, and we can unpack them a little bit more if you'd like. But this is one of my favorite communities. So if I could, I'd take you to Longmont, Colorado. And this is on the courtyards, the outside areas where residents that live in greenhouse homes in Longmont, Colorado, these are the Hover greenhouse homes, they were able to eat outside, socially distant, but they were able to get outside and enjoy fresh air, enjoy sunshine, and really just experience a quality of life that their traditional counterparts, many of them, weren't able to do. Now, I can tell you as a nurse, there's a reason that being outside is good. It's not just it gets me outside my room, but there's something about fresh air, there's something about sunshine that has such an impact on our mood, on our sleep, on our immune systems. There's something about being able to see each other besides being in your own room that would really contribute to your attitude, to your affect, to your ability to be outside. I think one thing about Hover Greenhouse Homes, they had a local, I believe it was an Eagle Scout troop that actually created a hug tent. And they brought the hug tent to the home, and they were able to, through the plastic sleeves and kind of the boards and so forth that protected everybody, they were actually able to give kind of that real hug. And there was some news coverage that we really enjoyed seeing, the joy of elders being able to experience a hug with their family member. And again, made possible, largely because of kind of that innovative forward thinking of many of the leaders of greenhouse communities. Something else that happened in greenhouse homes, and that's gardening. 3 pictures represent 3 different communities across the country. I know the one on the right is in a community in Arkansas, and I think the one in the middle is out of New York. I don't remember the left. But what we found through the pandemic is that people needed something to do. And I don't know about you, but being quarantined to my home, especially those early months, I was itching to get outside and itching to do something. And Pam, as you said, we want to get back out and travel again and just see other people. Elders are no different. And so especially the particular pictures that you have here are people that are living with dementia. But here's the reality. you know, when you find meaningful and purposeful things to do that are important to the individual. The gentleman on the right was a farmer, and there was nothing he loved more than to kind of watch his crops, plant his crops, harvest his crops. So what he was able to do here was to absolutely be able to do something. And you see his gardening gloves and everything on, and getting his hands in the soil was really meaningful and important to him. And it was really interesting, the care partners that worked with him, it was, you know, their thinking, their creativity that just said, okay, so here's what they say we must do with regards to social distancing, with, you know, the ban on family visitations and all these other things, but what can we do? And what they were able to do, the small size, the easy access to outside enabled them to get out and really to make a difference, and just think about how that person is feeling after being able to do something like that, as opposed to being quarantined or locked down in their room. I think probably my favorite was the quarantine that our greenhouse homes in Tupelo, Mississippi did. And you can see this is a care partner that is grilling. You can see an elder who lives in that home supervising from behind. And if you look to the right, you'll see some of the beautiful things that have been on the grill. So here's where their creativity manifested. They said, here's some things that I think we can do. We can't do the real barbecue where the family members come in, but there's a nice fence that kind of has their courtyard kind of in this space. Family members actually attended, albeit on one side of the fence. The elders were on the house side of the fence. And socially distant, they were able to share a meal, have a quarantine, and do some things that would be important to their culture and important to who they are. And they talked about some of the incredible experiences they had through that time. So I'm going to stop sharing, Pam, and then you and I can maybe unpack a little bit about the outcomes, and not just the data, but also kind of the social experiences that they were able to have.
Absolutely. Those were wonderful, wonderful examples and inspiring that what you can do with this type of model when you have the small home environment. One of the things that I thought of was, and to ask you was, what is the staff retention rate in greenhouse? Because that had to do with the COVID rate. So I'm guessing that staff retention is much higher for many reasons.
It is, and you know, so we will be looking at data for 2020. You know, as we get into a new year, we do kind of an outcomes assessment. We really want to see what retention rates look like. So typically rates look really good in, I'll call them normal times or pre-COVID times, shall we say. And here's why I would say that would be true. This is not just a job, but it really is a path to a career, something in which you are gaining life skills, where you are gaining the opportunity to learn, to grow, and to really be able to deliver an impact. You know, we use the universal worker model, so that direct care staff is doing the care, but they're also doing the cooking, which means some of them have learned to cook for the first time, and what that does to that sense of accomplishment and satisfaction in being able to learn a new skill. They do the laundry, they do the cleaning and that sort of thing. They've learned how to budget. They've learned how to use technology that they may not have had in their own homes. They're a household manager, essentially. And in a COVID time, they've also become surrogate family members with the family visitation ban. And so what does that have to do with retention? It has everything to do with retention. You know, when you feel more satisfied, happier, when you feel more involved in the decision making about problem solving, what's happening in that home, and not marginalized, think about what that would do to your wanting to stay a part of the organization. I think the question for us would be, so in COVID, if a person, an asymptomatic staff member, tested positively, they had to sit out for a couple of weeks, even though they had no symptoms. And so I will be curious just to see how that might impact retention, what happens when you go off and you come back, and, the challenges if I'm somebody who didn't go off, but I have a new person coming on to work with me, am I getting a little bit, workforce fatigue and stress, I think, has been a monumental problem. And so I'm just eager to see how it's manifested. And again, we may have had staff testing positively, be it asymptomatic or not, that were not able to work. And the impact on staff, I think we will study a bit more.
Yeah. It comes to mind, Susan, you and I previously, I think I've shared this with you, that my mother had Parkinson's, and back in 2005, when she really needed to go into a higher level of care, my sister and I, looked high and low for what we thought would be the best care for her. And being in Texas, we finally found a residential care home, is what they're called here, which was an assisted living for 12 people was the maximum. And so it's funny that, they weren't a greenhouse, but back then I can look now and think, wow, they really did have this greenhouse model going. It was very open environment. So many things that I know you are doing long before then, when I didn't even know greenhouse existed. The interaction with the staff, they were a family. They had very low turnover.
Yeah.
And like you said, the staff did many things. They didn't have one single thing that they were doing. They really connected. My mother needed extensive care, and she got it there. I mean, but what I always told people was the most wonderful thing about knowing when I walked out the door that she was going to be loved, almost like I could love her. I don't know if that comes close to how a daughter can love her, but it was pretty doggone close. But all those little things that you're able to do when you bring a home environment into just a smaller number like that, you're empowering the staff in many, many ways. You are really able to deliver that person-centered care. I know person-centered care, often gets overused. It's hard when you've got large communities. But I'm going to give you an example, and I don't want to take over your
please
talk about, but just a very small example. She did not like to get up early in the morning. That was when we sat down the first time to talk to the staff about, what is our mom like? What doesn't she like? She liked to eat her breakfast. She liked toast and jam, and she liked her special teacup. She didn't like mugs. I mean, all those little things that were not little things. They were really things to her. That's what you can do in this environment that is not so easy to do in a larger environment. And those small things become the really big things. Would you not agree?
Oh, it's the essence of our humanity, be they simple pleasures or something that perhaps is a bit larger, but it really, one of our mantras is it's all about relationships, and relationships are the bedrock for what you described as person-centered care. We call it relationship-rich person-directed living. And it's not just about being known from your care needs. I call it whole person approaches, where we really seek to understand that person as an entity that is just not their diagnosis, but who they are at their core and the intrinsic worth and value that each person possesses. Your mother was valuable, and to your point, they played a role like family members because they were in relationship. They could play the role because they were in consistent, dedicated assignments where they were working. You can't be coming in and out, and I'm over here today and over here tomorrow and over here the next day. It really is about consistency and a dedicated team that goes in and out. And a comment on your the different things that these workers do. I'm amazed at what some of these folks are able to do. I have a picture of one that's caulking in the kitchen, just a little seam there in the countertop that happens to have been a woman who was caulking it. And I thought, go girl, that's pretty cool. But what we know with the versatile worker, what does that mean? That's fewer people that are coming and going, that are potentially bringing this deadly virus into the home, sometimes unwittingly. They don't even know that they are asymptomatically bringing something in. So the fewer interactions and really the fabric of a home and really creating that sense of family. And you said the word love. I mean, that's what family is all about. And I think we have a video that's called Where Love Matters. And we really believe that, I think care partners all across the country have that love in their hearts and they're so eager to let it flow. I think the greenhouse model and its environment and its philosophy around a meaningful life and empowered staff in a real home, it's just that perfect place to let it rip, let it flow, and to really build those relationships.
Absolutely. And you know, I think it says so much about, you know, we ask ourselves, what is it going to take moving forward with, you know, so much of what COVID brought to light and what we need to be changing. And of course, you know, we need to be addressing the workforce. We need to be really looking at what can we do better to empower caregivers, because most people who come into this caregiving role are natural, are nurturers at some point.
Absolutely.
And when we don't give them the opportunity to nurture that personality within themselves, they will go somewhere else or sadly leave the industry altogether, which we don't want to see that happen, certainly, because we need these caregivers. But I definitely see that what I was able to witness in the 3 years that my mother was there was were happy, satisfied workers who really, I don't think, considered themselves a worker. It was their mission, and they cared just as much about each other and the residents they cared for as their own families, because, like I said, they were a family. Cannot agree with you more on access to the outdoors. That was something they did every day. Of course, in Texas, we have pretty nice weather most of the time. And so for much of the year, you know, we're able to go outdoors, and they had not a huge garden, but it was a courtyard where even those who, you know, couldn't walk out there, some of them were in bed. They were outside every day that was nice for a period of time, often eating out there. And can you put a price on sunshine and being around nature?
I can't.
No.
It is so invaluable to me.
Yeah.
I'm an outside nut. I love to be outside.
Yeah. I did more in my garden from March to into the summer than I had for a long, long time, because I love it so much. So those addressing those holistic needs, that again, you can do in a smaller environment. So let's talk about where you think, from all your expertise and vision and all the work the greenhouse has done, what have we learned, and where can we go to expand this, or at least bring in some of these valuable concepts into the current nursing home structure that we have in the country?
It's interesting to me in my tenure, actually it'll be 13 years, the beginning of March, that I've been a part of Greenhouse. And we have had more media attention in the last 10, 11 months as a result of COVID than I think we've had the entire tenure of my time there. And here's why. I think people are looking for solutions, and they're looking for, well, what's worked. And some people have advocated, kind of alluded to, let's abolish nursing homes and let's put everybody in home care. And I would say it's not an either or, it's a both and. And I think, there are many things that I'd like to see happen from a policy perspective, from a funding perspective, that would really, let's right size. Right now, Medicaid is if you are needed to have Medicaid funding, it's likely going to support you in a nursing home and not in your own home. There are very few Medicaid funded home and community-based services that would work for you. Let me back up. Let me share my observation as a nurse who was a director of nursing, had this call to action moment where I said, long-term care is not good enough. This was when we were literally tying people up to keep them from falling. And I thought, this isn't working for me. It just doesn't seem to be right. Went into home care, kept people in their home. I was a geriatric nurse educator for years, and then stayed in home care when this program ended. Here was my observation. In 2001, I left it, went back into long-term care because home care was cost prohibitive or socially isolating. If you had the wherewithal to bring home care in, then you were pretty much set. But here was the other thing. Even if you did have the wherewithal, it was often socially isolating. And I can tell you, I experienced that personally with my mom and stepdad, who I would say it was probably a blessing. They passed, both of them, before COVID hit. It was late 2019. But with all the home care, and we ended up with my stepfather after who was living with dementia. After my mom passed, we had 24/7 caregiver help. And as much as we tried to support and be there and be everything that we could, it was costly, very expensive. But I just felt like he was missing out outside of his caregiver, which between you and me, he wasn't thrilled with. That was it. That was his life. And we were in the process of trying to figure out and there wasn't a greenhouse in the community where he lived, but I was trying to find that small place where he could really have some socialization, where he could really be kind of known as who he is, and not this caregiver who really wanted to make sure that he fit her schedule. All that having been said, so I went back into long-term care in 2001. And I thought, it's time to reform long-term care. And that has been my quest, really, ever since I began. But I would say it became even more significant when COVID hit. It's like, to your point, Pam, when you said the light has been shown on nursing homes, they've exposed the flaws in our system. They have shown the light so brightly to say, no, that did not work. Semi-private rooms don't work. I would say what I'd love to see is that we need to reimagine nursing homes so that we eliminate semi-private rooms. If we know that, the likelihood, if my husband, I share a room with my husband, I'm just saying, if he gets it, I'm pretty likely to get it myself. So a private room for elders would be incredible. Greenhouse homes have a private room and a private bath. They have their shower in there. So that gives them that privacy. When you think, again, a nurse, infection control, think about how much better that is in mitigating the spread of the virus. So I'd love for us to think about those traditional buildings that have semi-private. Some have 3 and 4 person rooms still. 3 and 4 person rooms, they should have been gone. But I'm advocating that we've got to get rid of semi-private rooms as well. We can't settle for good enough, because good enough did not get us, didn't do well when we were trying to mitigate the spread of the virus. Again, I talked about funding, and I think we have to really consider where funding goes. I would love to see Medicaid reimbursement go up. I think incentives matter. I'd love to see financing options so that we incentivize through attractive financing opportunities. What does it look like to incentivize building what we know worked pretty darn well during the pandemic? And be it greenhouse or small house or something that is, and again, it's not just the physical environment, but it was the staffing structure. It was the philosophical culture that was there. It really was the comprehensiveness of change that worked so well. Those 4 homes that I showed you in the virtual tour, I talked to the CEO just before our call today. He hasn't had one elder case of COVID, not one, in the entire pandemic. It's Rhode Island outside Boston, and Boston was a hotspot early in the pandemic when it first hit on the east side of the country. It was New York, New Jersey, Boston, kind of that area right there, not one case. And today they have across the parking lot, they have a traditional building. They have 34 cases there today. In the greenhouse homes, nothing. So same area, but what they've been able to do to really mitigate the spread of the infection, keep it out of greenhouse homes. Smaller is better. It really does, size matters. And that private rooms, access to outside, all the things we've talked about.
Yeah. This is a topic for a whole other session, but I have to believe that the financial efficiencies of a greenhouse, small house model far outweigh a larger institutional model for so many reasons. One, I mean, if you just looked at staff, it costs a lot of money when we lose staff and we have to retrain them. That's one area. But again, when you're training staff across with cross training, so doing other things, they may be cooking, they may be, you mentioned caulking, they may be gardening, they may be, so many of those are separated in a larger community environment where all of that costs a lot more money. So, again, from an operator perspective, I would venture to say that the efficiencies are significant when it comes to financial alone.
There's a business case to be made for culture change and for this model in particular. And when you are in those consistent assignments, when you really know who the people are that are living in that home, you're better able to control food costs. You're better able to that early detection. If somebody's not quite right, you're able to intervene much earlier. So think about the impact then on medical supply costs and all sorts of other things, not to mention the quality of life. And, so many times I think people think the big box nursing homes, that's where you gain economies of scale and efficiency and so forth. No, you gain efficiencies when you deeply know who a person is, when you're able to look more one-on-one what somebody needs, as opposed to one size fits all, everybody gets oatmeal for breakfast. No, only one person wants oatmeal. Everybody else, we're going to do something different. So relationships matter, leadership matters. And I think that's the other thing that I have observed over my tenure with Greenhouse. And that is leadership. Leaders that fully buy into the model I had one leader say, you can't half jump. You can't say, well, I'll have a little of this and a little of that. We'll kind of do the self-managed work team, but I don't know if I fully buy into it 100%. But she says, no, you've got to go whole hog. You got to go in there. You've got to acknowledge the power of normal. What happens when we normalize our environments? We completely go there. 10 or 12 private rooms, access to outside, really buy into what that physical environment is doing, really buy into that relationship-rich, person-directed care, our mindset that says this person has intrinsic worth, they're of value. I see the person first, and I will then take a look at the diagnosis, but to really understand that whole person approach. And last but certainly not least is that empowered staff model. And empowerment is one, making sure that staff has the necessary support to be successful. That means education. That means in a case of COVID, they've got PPE, they've been tested, they've got all the knowledge, everything they need to show up and be successful. And it's holding them accountable and making sure that, you know, it's not, okay, here's all the support, go for it, and you're on your own. But accountability, it's that balance of support and accountability, and making sure that leadership is accessible, it's collaborative, it's participative, that, you know, we're in it together. And when that happens, you will achieve the economies of scale.
Absolutely. The ability for innovation and creativity to happen, to be accepted, just like the examples you said of what the staff were able to do with the barbecue and the Eagle Scouts. And so many times in larger organizations, there may be some creative ideas, but it takes a long time to get those passed. And I can say, we're a small business ourselves, so I love being able to, hear an idea and say, let's try it,
Absolutely.
let's go for it. You can do that when you've got a smaller environment. You've got the people, and you said something about, the person rich, what was the title?
Relationship rich, person directed living.
I love that. That can only happen when there are relationships. You have to have a relationship to be able to provide that level of care. Would you not agree?
Oh my goodness, absolutely. Absolutely. One thing, just real quick, just share with you what I believe is also important, and that is our mindset. I can tell you as a nurse who, kind of cut my teeth on the institutional traditional way of doing things, I can tell you that we oftentimes bring unintentionally probably, but an institutional traditional mindset. And we have certain beliefs we bring into the relationship and into our work. And we believe that we've got to have a mindset shift that really does see the intrinsic worth, the value, and the opportunity for ongoing learning and growth, be it the elders that are in your home, and that opportunity even for a person living with dementia to be able to connect with people, to have a relationship of some sorts. There's much more there than we might give credit. And I just think to be able to see the person differently, it requires a mindset shift, and to really want to ensure that they are portrayed in a dignified, humane way is important.
Yeah, and to be open to learn from them, because they have so much to
Absolutely.
offer.
Absolutely.
So much to offer. And I found that oftentimes with the staff, with the home that my mother lived in, is they just embraced the wisdom and the laughter and the humor, and they all kind of had this great camaraderie of wanting to know more about each other, and embracing their differences.
Exactly.
And the things they had in common, which was it was a beautiful thing to see. We have some questions. Oh, somebody said they were having a hard time hearing me. Oh goodness, I'm sorry. Hopefully. Here's a question. If money was not an issue, what would you have on your wish list for these residents in order for them to have an increased quality of life? And what would you have on your wish list for the staff and caregivers to make their jobs better and easier? Good question.
That is a great question. And um, so what I would say is that it's not a one size fits all, because I think as we're talking about the individuality of those that live in greenhouse homes. So I think, we need to understand, and sometimes there's simple things. I can tell you that during COVID, I've heard a lot of people talking about bird feeders. I've heard a lot of people talking about the technology that enabled connection. But I think we need to be able to kind of figure out, and that's what's so cool when you're at home, what's important to you to have a better quality of life. And it's highly individualized. And for staff, I think it probably is really important to make their jobs better, easier. I think, everybody responds to that opportunity to learn and to grow, to be recognized, to be valued, to be in relationships, to love and be loved. And I just think the environment, the model just is so conducive to being able to do that.
Don't we make it so complicated sometimes when the most basic human needs can fulfill us in
Absolutely.
just ways? I think in so many larger institutions, it becomes muddled and we lose that the most basic needs that we all have. Here's another question. Susan, it appears you are talking about quality of life, having a roommate to socialize with versus quality of care, private rooms for infection control measures. How would we replace the socialization that occurs in semi-private rooms when we replace them with private rooms? Good question.
That is a good question. And I would say when you're in a semi-private room and you're in a room and you don't know the person, maybe over time you'll get to know the person, but it may be that you don't necessarily get along with that person, and that doesn't necessarily contribute to high quality of life. But aside from that, let's talk about greenhouse. Greenhouse is not just about the private room for the elders, but it is about that central community. And if you saw that hearth area, and during COVID time, I will tell you, it was more challenging to meet in the hearth area. It happened. We had people eating at the kitchen table. You saw that one table. That's all about community. That's all about quality of life, is being able to have good food in the company of people that you care about. And so they would be able to kind of socially distant and have a meal. In some of our greenhouse communities, one at each end of the table, and then they would have others kind of socially distant. And then sometimes they'd have tables in the living room. So socially distant, once again, they were able to do things. I showed you pictures of the outside. It's all about relationships. It's all about creating intention, about really, to your point, the semi-private kind of afforded that opportunity for that human connection, because that's what we crave. And as Pam and I were talking earlier, we certainly were highlighting the fact that, because we crave these relationships, it's so important, that we get outside, we have those opportunities to connect there.
Yeah, I just looking at the tour that you gave us, it was all about communities. Love the idea, which we had in the community for my mom, big table where staff and residents eat together, shared good home cooked meals that sometimes they helped make, and the residents helped at whatever level they could. It was really beautiful. So we have a question. Are there plans for those types of communities throughout the US?
So there are 300 homes right now across the United States in 32 states. We do have, I think, probably a handful of other states that we're working with right now. So we are, hoping to see over the next few years more greenhouse communities. We really want, especially in light of what we've learned in the pandemic, we would love to see this become an option much more widely. And again, I believe incentives matter. I believe that, goodness, we have been through such incredible challenges with COVID. So I am hoping that policy changes and incentives might happen that would really incentivize this model. So we're having lots of conversations and really trying to determine how this can be much more widely available.
Yeah. And do you have any in New Jersey was one of the questions.
We do have a couple in New Jersey.
Good. Anyone else that has any other questions? We're kind of getting close to our 1 hour that we try to stick to because we know everybody is busy out there. Let's see. Is this always one house with 12 people?
It is. So there may be a community like what you saw in Rhode Island, 4 homes, but 12 people in each home. So no more than 12 in a home. And kind of going back to that other question about semi-private rooms and so forth, when you've got that small size, you're functioning as a home. And, growing up, I had my own room and my brother had his own room. But yet we came together, we experienced socialization when we had our meals and we would do things together. Similarly, this is the real home. And this is a place where you can love and be loved. And, that's what really matters at the end of the day.
Yeah. Are there any in Florida? Was one of the questions.
Yes, we have assisted living, 2 homes in Jacksonville, Florida, and then we've got 12 homes in Pompano Beach, Florida, South Florida.
Wonderful. So we will be, I'm sure there are going to be other questions. So for all of you, we will be sending out a recording with this, with Susan's contact information, my contact information. A few other questions came in just now. For someone who is interested in building a greenhouse community, how do you suggest they begin the process?
Boy, in 3 minutes. It depends on the state you're in. It depends on so many different factors. If you've got land, I mean, we have kind of started developing a startup toolkit to really help put you on your way. But visit our website, thegreenhouseproject.org. And there's a place where you can send information. You feel free to reach out to me, Ryan, R-Y-A-N, at thegreenhouseproject.org. I would also encourage you to listen to our podcast, Elevate Elder Care. It's on Apple, Spotify, and Stitcher. And I tell you, I am talking to some of the smartest people around the country about their perspectives on what they see we must do to elevate elder care. And I have learned so much. We launched at the end of July, not traveling. We had the opportunity to do some things that we hadn't done before. And I can't tell you how much I've enjoyed some of the conversations I've had. So I would invite you to listen. There was one today, a CEO from a community in Atlanta, Georgia, not a greenhouse community, but boy, is he a wise leader and had so much to say from his perspective going through COVID, but other incredibly wise people. So please listen.
Great. We will add that also to the recording, the podcast information.
Great.
We will be putting, also for all of you, we'll be putting this up on our YouTube channel, AGE-u-cate Training Institute. So the last comment that I have here is, Susan, your passion for the patient and the homes you represent is inspirational. Thanks for the great hour we have spent together. Stay well. So I think she said it all. This is
that's great.
Time for you to share and for us to learn and be inspired by what we can do. And through all, well, as we all know, challenges bring us to a point where we have to learn and grow. And that is what COVID has done. And as challenging as it has been, it is an opportunity for us all to step back and say, we can do things better, right?
That's right.
At some level. And so thank you for the time that you spent with me and with all of the participants we've had together, and look forward to seeing what we will all be doing together in 2021. So thank you, Susan. Have enjoyed this.
Thank you, Pam. And I hope I'll see you at a conference in person. If not this year, next year for sure.
Absolutely.
We'll stay in touch.
And thank you everyone for being a part of this. And we'll see you next month. You'll find out who our speaker is. Thanks again.
Thanks so much. All right. Take care. Bye-bye.